I'm going to talk to you a little bit about tummy tuck surgery. I think one of the most common questions that we get asked is, do I need a full tummy tuck or a mini tummy tuck? And people often think a mini tummy tuck means that there'll be a little tiny short scar, and a full tummy tuck means there'll be a big long scar that goes out to the hips. But in fact, that's actually not the major difference between a full and mini tummy tuck. If you have mostly excess skin and fat on the lower abdomen, but it goes out way out to the flanks, a mini tummy tuck might be all you need to remove the skin and fat down there. However, if you do a little tiny incision and you leave excess skin and fat on either side, it won't be a good result. So sometimes a mini tummy tuck has a long incision. And conversely, sometimes a full tummy tuck doesn't necessarily need to have a long incision. If you have lots of loose skin on the upper abdomen, but on the lower abdomen it's mainly in the midline, you might be able to get rid of it with a fairly short scar. Scar length is actually not one of the defining criteria for a mini versus a full tummy tuck. The majority of surgeons, what they mean by a mini tummy tuck is removing tissue just from below the belly button, and a full tummy tuck involves making an incision and dissecting all the way up to the ribs and lifting all the skin and tissue up, pulling it tight and removing the excess tissue from the bottom with one long low scar. So in fact, mini and full tummy tucks have more to do with the regions of the abdomen that are being operated on, not the length of the scar. The other major difference between a full and a mini tummy tuck is typically with a mini tummy tuck, we don't tighten up the abdominal muscles or the rectus muscles. The reason being, if we were to tighten up only the muscles on the lower abdomen, it would actually push all the stomach contents up and give you more of a bulge on the upper abdomen. Occasionally I will do a very slight tightening of the muscles with a mini tummy tuck, but be very, very careful that I don't overdo it. Whereas with a full tummy tuck, we can actually tighten up the six-pack muscles or the rectus muscles all the way from the top, all the way to the bottom, and provide a nice tight result. And sometimes I'll even do more tightening or plication along the sides to even further give an hourglass figure and further define the results. So I think those are really important things to understand about full versus mini tummy tucks. The other thing to realize is what else can be done to enhance the results. Tummy tucks are often done with liposuction. For example, if a person has a bulge up here, or sometimes they have rolls underneath their breasts, we can contour those down with liposuction, and that's done through just a few extra little tiny incisions. And sometimes people will actually want liposuction of the love handle area or the flanks done at the same time as a full tummy tuck. There are multiple different variations of full and mini tummy tucks. For example, one mini tummy tuck, we actually lift up the belly button and pull it a little bit lower. That's a floating belly button mini tummy tuck. There's full tummy tucks where we actually remove tissue not only in this direction but up and down, and that's called a fleur-de-lis tummy tuck. They all have their own risks and benefits, advantages and disadvantages, so it's really important to see a plastic surgeon who does a lot of tummy tucks and get a proper in-person consultation before making any final decision.